Hey everyone, and welcome back to What After Dentistry. I hope that the What After BDS series helped you to understand of all the possibilities and it was helpful to you. In today's video, I'm just going to give you a quick recap in terms of providing a consolidated mind map of the possibilities that we have discussed in this series. So let's get started. As I always say, please subscribe to our channel as that is the only motivation we have to create such kind of content for you guys. So click that subscribe button and don't forget to hit the bell icon. Now again, let me share the screen with you. So yeah, that's it. So that's a small mind map that I have created for you guys just to make you aware of the various options that are available um, after BDS. So these are the three major categories. So either you can opt to study further, you can opt to work abroad, or you can start earning right after BDS. When we talk about study further, under this, we basically have the clinical courses and the non-clinical courses. Now, under clinical courses, you can either pursue these courses from India or outside India. So courses which are there in India, you can opt for MDS, you can go for the fellowship programs, which are usually of an year, 1 or 2 years. Then diploma programs, which are anywhere, these are like even 1 day diploma programs, like the CD programs that we have. And some other masters, like you have a specific masters for implantology. So these master courses are not very, they are not very prominent. Only 1 or 2 colleges might be having it. But MDS and fellowship, these are the two, the two basic or the major courses that you can actually opt for in the clinical side. So always go with MDS if you are someone who is really serious about practicing dentistry and you want to excel dentistry in any one of the branches that you have interest in. So go with MDS. 10 years down the line, this will definitely be very beneficial. And if you're someone who is after, say, you want to work first like 2 years, 3 years, and then you want to find that which branch basically excites you, then go with the fellowship program, because again these fellowship programs are also practical oriented, so they do allow or they give you some patient exposure in all the branches that you in any of the branches of dentistry you want to go with the fellowship. Then outside India, if you are keen to pursue the clinical courses, you have master courses in dentistry, which is Master of Science. So you have it in aesthetic, you have it in restorative dentistry, then you also have it in general dentistry. So depending on, again, research on the courses, Master of Science, dental courses which are available. And where if you opt for European countries, you need to look out for courses which have or which are taught in English language. Mostly the European countries, they will be taught either in Spanish or German. Basically, the language, the first language which is followed in those countries. Then you can opt for DTS in US and or Canada. So in US, DDS is a mandate, as I mentioned before. For Canada, if you clear both the part of dental licensing exams, you're not required to pursue DDS. So it's totally your choice whether you want to pursue DDS or not. And then there are certificate diploma courses in various branches, like you have it again for aesthetic, for restorative, you have it for implantology. So any of the courses or field of area of interest where your where you want to pursue a certificate course and enhance more on the clinical skills, those courses you can pursue outside India. So that's about the clinical courses. Talking about the non-clinical courses, you have it either in the healthcare or non-healthcare. When we say about the healthcare, then these are all the possible courses in the healthcare field. So hospital management or administration, public health, health informatics, forensic odontology, oral biology and sciences, biomedicals, biomaterial science or dental material science, research, clinical research, stem cell. So all these are the healthcare courses. And then in the non-healthcare, you have it as business administration, digital marketing, civil services, law, data science, economics, and anything else that you desire to do. So that's about the courses. You have, just to compile, clinical, non-clinical. Under clinical, you can pursue courses from India or outside. And in the non-clinical, you have healthcare and non-healthcare related courses. Then we talk about starting, or you want to start earning right after BDS, you don't want to study further. So under this, you have four basic heads. So you can work as a dental tutor, or as a in the academics basically. You can practice, or you can start with your dental practice. You can opt for non-clinical job roles which are now available, or you can set up your own business. Now, as a dental practice, if you want to work as, or you want to practice dentistry, then in that case you can work as an associate to start with. If you're confident with your skills, and in the internship year you have fully utilized in enhancing your clinical skills, knowing or understanding the practice management skills that are required, then you can always set up your own practice. Before you set up your own practice in today's time, make sure that you have your own USP created. When I say USP, that means it is the unique selling proposition. So patients now, they are very smart. They have options. So they have 10 dental clinics where they can actually opt for, and they can avail these services, right? But why a patient should come to you, why they should not go to the other dentist who's there in the vicinity, is something that you should need to think on, and you need to work on. Then only you can attract more patients, or you will be able to provide the best of services to your patients. So either you can give some add-on services, or you can provide some kind of value to your patients, or create your own USP, like some clinical skill which you feel in your vicinity no other dentist does, or they have that skill, right? So when you set up your own practice, make sure that you have this USP with you, which will attract the patients, and they will come more and more to you. Always in today's time, make sure that you know some marketing skills, and you know how to market your practice outside. So how are you going to basically cater to the patients in your vicinity? Then there are the government vacancies basically. So for this section, you need to be very aggressive in terms of follow up, and in terms of finding out the vacancies. You need to be on regular basis, you need to check their websites, newspapers, or the advertisements that you see for the vacancies, and you really need to push yourself really hard to get into the government sector. Then talking about the non-clinical job roles, so here there are various options. You can start with education. So if you're good in teaching students of any sort, that can be any skill, as I mentioned in my videos before. It can be related to dentistry, it can be related to any other skill that you think is beneficial for the masses. For example, you're very good in time management, or you have very good organization skills. You can always create a small course on that, and you can teach people. So education is one area that you can explore immensely, depending on what skills you are good at, and you think that people will definitely be needing these skills in their day-to-day practice. You can join dental product companies, dental research. These are all the same options that I had already listed before. It's just that I'm compiling everything over here. So yes, these are all the non-clinical job roles that you can opt for, and don't forget the opportunities that you will that you will get after you pursue any of the healthcare courses that we discussed or that we saw, because these healthcare courses again will land up you, or they will provide with a non-clinical job role. And lastly, setting up your business. So setting up a business, again, it can be in the healthcare sector, it can be in the dental sector. Like you can create your own dental lab, right? You can set up your own dental lab. You can have a dental materials platform, or you can create you can create a health cart kind of an e-commerce platform. So anything in the healthcare sector, or maybe non-healthcare, which you're really good at. So then we have the third option, which is of work abroad, which we have recently covered in the last video. So I'm just going to show you the level one, wherein you can work as a general dentist. You can set up your business in the country that you intend to settle. You can also opt for other clinical profiles like dental assistant, or dental hygienist, and the non-clinical training profiles. So for general dentist, you can choose the countries where you need to appear for the licensing exams, or you can choose those countries where the exams are not required. You can easily get the license. But for these countries, make sure that you have a good amount of your experience, because without experience, they will generally not be giving you the license. Other clinical profiles, you can work as a dental assistant, dental hygienist, dental therapist, or dental nurse. And for the non clinical trainee profiles, you can work in the DPM, which is dental practice management. You can work in the dental research field, clinical research, or health insurance. So these are the basic requirements or basic profiles that you can basically work on if you're thinking to work abroad after BDS. So these are all the options that you see. I have just shortened it, I have zoomed it out so that you can see all the possibilities. And if you count all these possibilities, these are almost approximately somewhere around they lie between like 45 to 50 options that you can opt from. So yeah, that's it, guys. And I hope that these 6 video series will help you to understand all the avenues and will help you to explore the options that are available after BDS or even MDS, or any person who's coming from the healthcare background or from the from the other medical streams like MBBS, BHMS, BAMS. So this video will or has options for those professionals as well. So I just want to conclude by saying that gone are the days when we as dentists would work just as dentists, right? In a 4x4 chamber. Healthcare in today's time is rapidly advancing, and it requires healthcare professionals like us to research, explore, manage, and identify the newer routes, technologies, and ways of expansion. We put in a lot of hard work and research to collate all this information and put it across for you guys, so that it gives you a hope that uh, there is immense scope in dentistry and healthcare. There is no saturation. It is just that you need to identify the right skill. You need to identify the your own USP that you are actually good at, and take that right decision at the right time and at the right place. We would love to hear what you think of the series, and so leave us your views, your thoughts in the comments below. And if you have any questions, leave that also. We will definitely be addressing your questions as well. Don't forget to like, share, and subscribe to our channel. I will see you in the next video. Until then, bye and good luck.